So at John Knox Village, we started hearing about a need for more Parkinson's care and support. Parkinson's disease is something that not everyone is affected by, but everybody knows someone that's affected by. And so it became a really big need. And as we started looking across our campus and the broader Lee Summit community, we found that there were not a lot of care and support services for people and their families that were affected by Parkinson's disease. So we decided to invest in the Big and Loud program here on campus. One of the unique things about our therapy programs at John Knox Village is that we have Big and Loud certifications for all disciplines. So that's occupational, physical, and speech therapy. It's very difficult to find in Jackson County. So we're thrilled to be able to offer all those, not only in our outpatient therapy clinic, but also in our home health agency for those that are homebound. And so we're really able to provide a lot of service and support for those that are impacted by Parkinson's disease.
Parkinson's disease is a disease that affects the brain and affects the patient's ability to move normally. They begin moving in smaller movements. Their voice begins to be really soft and quiet and difficult to understand. We offer LSVT, Big and Loud, here for our Parkinson's patients. It's a specific protocol that's designed for Parkinson's and other movement disorders that really recalibrates the brain, teaches them to move in bigger movements and with louder voices.
In May, Bob fell down our basement steps. He had gone to the hospital, the therapist came in, and we had gone to outside therapy, and it just didn't work for Bob. He needs individual care. So I called our senior consultant here and I said, is it possible to do therapy here at John Knox? Absolutely. She said, there's a Big and Loud program you might want to try.
So the LSVT Big program is a prescribed program, so it's going to last for 4 weeks and you're going to see a therapist 4 times a week during that time. The idea here is to reach a certain level of intensity which is required to change the brain, which is what we're trying to do here.
When he first came in, he was taking baby steps and very shaky. After the program, his stride was almost back to normal and very definite. He would walk out of here and I could feel his confidence.
The Loud program is really beneficial to people because communicating your basic wants and needs is something we all need to be able to do. People with Parkinson's often have a lower vocal loudness level. Their tone is usually a little more gravelly than they're used to. And at the end of the day, their voice tends to wear out often. And so I will have people say to me, I whisper sometimes, and I don't know why. And it's been awesome to see that after even a couple weeks, I ask them, are you whispering anymore? And they go, I haven't noticed me whispering. So it's been really fun to see how quickly people can improve their ability to have their voice heard.
So far, it's been a pretty positive experience.
Mm-hmm. Very much so.
Well, you're going to find LSVT Big professionals all over the area. But here at John Knox, we work a lot with our older adults specifically. We're comfortable with them and we know how to help them to achieve the best results possible.
So as far as getting the LSVT program, for those patients that are higher level or more mobile, they can go to the Outpatient Therapy clinic here at John Knox. But for those that have a harder time getting out of the home, it's more of a taxing effort and they're considered homebound, then we can actually bring that program into their home. So in order to get the LSVT program, we encourage our patients or their loved ones to talk to their physician or their neurologist, and we can bring that program into the home for those folks that aren't as mobile. We need a referral from either your physician or your neurologist, and we can do that both on the Kansas or Missouri side, as our physical therapy, occupational therapy, and speech therapy staff are certified in the program. Upon completion of the LSVT program in the home setting, we can discharge to either a home exercise program where we have given daily exercises to the patient or the caregiver to complete, or more preferred, we would like to discharge to outpatient therapy here at the Village.
So our mission first and foremost is to serve our residents here on the John Knox Village campus, but we also want to serve those in the greater community that need that help and support. And we do that through our Village Outpatient Therapy program and through Village Home Health, which are both available and open to the greater public.
I would very much recommend the Village Outpatient Therapy Big and Loud program. The therapists are exceptional, very patient, and very kind.